Penn State University is one of the top 20 research universities in the country, and the Department of Psychiatry is part of the Milton S. Hershey Medical Center and the Penn State College of Medicine. We have programs in the clinical arena providing psychiatric services to Central Pennsylvania region. We have educational programs that include residency programs, child fellowship program, a psychology internship program. We teach medical students and graduate students. We have research programs that include cutting-edge research in sleep, in mood disorders work, in child psychiatry, child psychology, and in addiction. The founding chair of our department was Dr. Anthony Kales, a sleep researcher who also founded the Sleep Research and Treatment Center, which has become one of the leaders in the field of sleep epidemiology, the influence and interaction between sleep and inflammation, and a leader in understanding the cardiovascular risk factors from sleep disturbance. Collaboration is key to what we do at many different levels. We have a collaboration with Pinnacle Health to provide care through the Pennsylvania Psychiatric Institute.
Pennsylvania Psychiatric Institute is both an inpatient and an outpatient facility. We have 89 inpatient beds. The adult beds include a geriatric unit. Frequently, many of these adults have medical comorbidities as well as their psychiatric reason for admission. We have a 16-bed unit for adolescents and a 9-bed unit for children. Our goal is to make Pennsylvania Psychiatric Institute an academic flagship for the department, both from a clinical perspective as well as for education and research.
The Department of Psychiatry and the Pennsylvania Psychiatric Institute partner with our community to provide programs that will benefit the community health, particularly programs in addiction and in facing depression.
One of the applications that we have is in working with patients with either prescription opiate dependence or alcohol dependence. And we're working with the care and treatment centers to develop an objective central nervous system, brain-based measure that helps us do a better job of making clinical decisions by giving us information about how vulnerable this person is to relapse and whether or not they may or may not have a chance of maintaining their abstinence once they leave the residential treatment and go home.
Penn State Health is focused on trying to help kids and adolescents who historically haven't had access to services. For example, Dr. Bobinski is working with girls with ADHD, which were traditionally ignored as a population of kids who could have ADHD. Doctors Murray and Pearl and their crew are working with young adults and adolescents with autism who have also been ignored.
We have a division of autism services that focuses on the transition for adolescents to young adulthood for individuals with autism spectrum disorder.
So many patients and families who are affected by mental illness and affected by behavioral health problems that really are devastating. And as an academic department, it's our responsibility to bring the resources of research, the resources of an academic university to focus on these problems, to generate the new knowledge that we need in order to bring individualized, personalized treatments to patients and families that will allow them to improve the quality of life that they're able to have.